Hello, everyone. My name is Victoria Walton, and I will be discussing the U.S. healthcare and Thailand healthcare contrasts and comparisons. So, the first slide, I would like to begin with saying that Thailand has a hybrid system with public and private facilities. It is universal healthcare in that country. They are financed through revenue from taxes, and the U.S. healthcare system is also a hybrid system, and it has public and private facilities, but most of their facilities are privately owned by businesses. The way the U.S. healthcare system is financed is through private insurance, payroll, taxes, and like beneficiary premiums as well. And we're going to go to the next slide. For access in America, right now our uninsured rate is pretty high. We have an uninsured rate of about 9.7% in the U.S. as of right now. That is due to the high costs of insurance rates, as well as premiums that have been going up, especially due to inflation and COVID job losses as well. Access has also been deterred because of discrimination in certain areas. The copays are too high for some people to afford, especially like low-income families. They're not able to afford these copays or even to go see a doctor, let alone to pay for the medications that they will be receiving from these doctors as well. Let's go to the next slide. Effectiveness. So right now in Thailand, their effectiveness is at an all-time high. They have been rated basically number one with friendly access to care, as well as just wonderful infrastructure. While as America it's not doing too bad, but it could be improving on its effectiveness, especially when it comes to the industrialized nations that are surrounding us. I'm going to go to the next slide. So, long-term care in America. As we all know, long-term care is usually paid out your pocket, especially with retirement funds. So, like, if you do have a retirement fund or like extra insurance and stuff, that is what's going to cover your long-term care, especially if as you get older and you start to go through the process of having issues like health issues as well. Sometimes people do take care of their family and stuff, but it's not as common as it would be in other countries, especially in Thailand, because Thailand, their long-term care is not really as great as America's, because they don't really cover in their universal health care program, they don't cover as much elderly long-term care as other countries do, so they can improve on that situation. Most of the times a family member or even someone in the community or a neighbor or something will help take care of their elderly families. Unlike in the U.S., we don't really normally do that. Next slide. So, U.S. healthcare spending. The per capita is about $11,945 in 2020. It has been a growing rate of about 4.5% as time is going on, and it's going to continue to increase as the years pass. I think that's one thing that America can work on, is like our healthcare spending. We do spend a lot on healthcare as well as other aspects in our government. Next slide. So health outcomes. Thailand's life expectancy has increased over time. Thailand's life expectancy is a lot higher than America's is, as well as their death growth rate has decreased about 0.020% over the last year, while America's has stayed the same, especially during COVID. Their death rate has basically stayed the same at a like 1.0990% rate. So that is one thing we can look at, like the healthcare outcomes, as well as like mortality rates and stuff like that, that we can improve on that. And I will say that in America, when you do go to the doctor, you do experience, like, the doctor will tell you about like health issues and like preventative care, which I think is a great idea, because a lot of people go through like health issues, like obesity rate in America has skyrocketed, and other healthcare issues that we face. And now we're going to go to the next slide. So things the U.S. could improve on. So we can improve on equity, healthcare equity in our communities, because a lot of people, especially minorities, face discrimination within the healthcare field, especially going to the doctor. People look down upon them, especially if like they can't afford the healthcare that they're trying to receive. I will say that with America, we do need to start looking into programs where we can help people that are at a lower income and don't have the access to public health programs, as well as just trying to get universal health care, to be honest, because right now a lot of people that even do have health coverage, it's pretty much expensive, and if you don't have a job that covers your health care, it's really expensive to afford it and continue to keep up with your premiums and all that stuff. So we're going to go to the next slide. So things that Thailand can improve on, especially the elderly care that they receive, as I was talking before. In Thailand, their elderly care is pretty much non-existent unless a family member helps them out. So they can improve and open up and expand their universal health care towards that, and try and come up with some programs that will help their elderly community. Another thing is, like, in Thailand, like, their health providers and workers, they're not really widespread, especially like in urban communities. So I will say they can work on that and expanding like the healthcare worker field, and getting some more people in these smaller communities so that they can get the access that they need to the proper healthcare and the proper medications and stuff like that. So we're gonna go to the next slide. Life expectancy in America is about 77 years in 0.28. In America, the population is continuing to grow. I think we just hit 8 billion in the world. But in America, the population is in 2020 was about 329.5 million people. And Thailand is doing a little bit better by having about 77.56 years on us for life expectancy, as well as like their fertility rate is pretty good as well. But they are a smaller population, they're a smaller country, so their population was about 6.9.8% million in 2020. So it has, I'm pretty sure it has increased. And especially since their death rate has been decreasing, so we're going to see them continuing to grow. Next slide. And then for the summary, so I would say like the U.S. Healthcare could learn a lot from Thailand's universal healthcare, because we really do need programs that can help us, especially with our costs going up. Like, America has one of the highest cost rates in pretty much a lot of the industrialized communities out here in the world. And we also need better access to proper health care, effective healthcare, because we do go through a lot with trying to go see a doctor. I will say the wait times aren't as bad as a lot of other countries that we have seen out here, but we do need to improve, especially